Today on Dueling Doctors, we're talking about everyone's favorite topic, sex. We all love it, right? One study said the average woman thinks about sex 10 times a day, while the average man thinks about sex 19 times a day. I'm thinking about sex right now. But what happens when your body won't cooperate and leaves you and your partner in a messy bed of sexual frustration? Today, we're talking about erectile dysfunction, low and no sex drive, and vaginal dryness. Different doctors from the worlds of holistic natural and conventional Western medicine square off on how to help you get your sexy back. Plus, how can you use a simple postage stamp as an important sex test?
It's holistic and natural versus conventional health experts with different opinions and one goal, to help you live a healthier life. Dueling Doctors.
Hi everyone, I'm Dr. Frank Spinelli. Each week on Dueling Doctors, experts from the worlds of both conventional Western and natural holistic medicine join us to debate and discuss the best ways to treat some of the most common ailments and illnesses. Today it's all about sex. Let's get started by introducing our guests. On the eastern end of the equation is licensed and board-certified acupuncturist and clinical herbalist Jill Blakeway. She's also the author of Sex Again. On the western front, from Mount Sinai Medical Center, is board-certified urological oncologist Dr. David Samadi. Welcome, both of you.
Thank you.
Thank you.
Our first topic is something we've all seen in a million TV commercials. It's about erectile dysfunction. Erectile dysfunction is a persistent inability to get or maintain an erection. The problem can stem from medications, chronic illnesses, to too much alcohol, or psychological stress. So what are the best ways to treat erectile dysfunction? Each of our doctors has up to 1 minute to present a treatment plan, and then the other will have a chance to rebuttal. We flipped a coin before the show to see who would go first, and Dr. Jill Blakeway, Sex Again, you're up first.
Well, I think the best way of explaining my approach to erectile dysfunction is to give you a case, actually.
Okay, let's
and
have
I'm going to call this gentleman Ed. It's not his real name. But
Or
Ed,
Eric, if you
or
like.
Eric, but it doesn't really matter. But Ed came to me. He'd suffered a really brutal divorce, and he was starting to date again and found he had erectile dysfunction. That is not an uncommon situation. He'd been to see his doctor, and his doctor had given him Viagra, which had been helpful, and he found out that he had low testosterone. And then he came to see me to sort of explore other options. I gave him acupuncture because there is really clear clinical evidence that acupuncture is helpful for erectile dysfunction. There's a study that looked at 250 men, and it's really very helpful. I think it's important to mention that we don't actually stick needles in men's penises.
Very good, because that was the first question I was going to ask.
I know you were thinking that.
Well, I didn't want to think about it because I made a cringing face.
I know, nowhere near men's penises. I also taught him some sexual qigong in my book, Sex Again.
What's that?
I know.
Qigong?
Qigong. It's like yoga.
No, what is that? Oh, it's yoga.
It's 2,000-year-old Taoist exercises. They're in my book, Sex Again. It's a little tricky to do on camera.
Okay.
It's a little long.
But it involves the penis?
But it doesn't involve, well, actually, yes, it does. It involves cupping the scrotum, in fact. But it's sexual qigong. And then I gave him herbs. And herbs are tricky because you do actually have to understand the underlying condition. I know you're probably going to talk about that quite a lot. In Chinese medicine, we see three main things. One of them is called kidney deficiency, and it correlates to low androgen levels, which poor Ed had, of course, with his low testosterone. One of them is called qi stagnation. It correlates to poor nerve conduction and is often related to stress and tension, which poor Ed had after his horrible divorce. And one of them is called blood stagnation. Korean red ginseng in clinical trials has been shown to
Very much so.
to
That's
really
the same
help.
thing as Asian ginseng.
It is. It's a different type. It's Korean red ginseng. I then put him on L-arginine. There's a study about that with pycnogenol, which is an antioxidant from pine bark. The dosage there, if anyone wants to try it, is 5 grams of L-arginine and 120 milligrams of the pycnogenol.
Can I just ask one question before we move on to Dr. Samadi? Why did he come to you if he was on Viagra? Was it not working?
No, he was happy with the Viagra. He just didn't want to be on Viagra for the rest of his life.
But he doesn't mind being on Korean ginseng?
Actually, eventually we weaned him off the Korean ginseng.
So he just needed to get over that little
he was having a bad patch, really. And I think he also was worried about the low testosterone and didn't really want to do testosterone replacement therapy straight away.
Interesting. All right, Dr. Samadi, I'm sure you see this a lot.
Yeah.
Men coming in with erectile dysfunction, various causes. What's your approach?
Well, you know, I think this is very interesting because I think someone like Ed, you have to look at him overall. You know, this is a man, I don't know how old he is, but he's going through a tough relationship, So stress actually plays a huge role in someone like this. He may absolutely be fine. He probably doesn't even need Viagra, but he's going through a divorce. Now he's going to a new relationship. So performance anxiety, getting to know the new person, all of that plays a big role. So I think, like, you know, what I would do is I try to get into some of the stress level, some of the changes in his lifestyle. Is he gaining weight? We have to work on that before you give them the prescription.
Okay. Well, let me just play devil's advocate. Viagra was not really indicated for stage fright, right?
Yeah.
You know, it was indicated clearly for people post prostatectomy where they had nerve damage from surgery, cardiovascular disease, diabetes, people with real medical problems that subsequently led to erectile dysfunction. I think it's become overused, and because people have stage fright or performance anxiety. So you feel there's no problem with prescribing it for those reasons as well?
No.
Or do they just keep it because they know they have it and they can use it if they want to?
No, that's a very good point. And I think one size fits all is not a good way to practice when it comes to this.
Absolutely true when you're talking about condoms.
So you got to be very careful.
Well,
and I think there's a lot of knee-jerk reaction going on with doctors just writing for Viagra or Cialis or Levitra. So when I get someone who is about in their 30s or 40s, they're very young, and there's absolutely nothing wrong with them. Giving Viagra to them, we know that it's psychological. So why would you give someone Viagra for a short period? It's more placebo effect, and there's nothing wrong mechanically with them.
But it does come with side effects. So you also,
so you got to be very careful. And if you ever do that, your point is well taken. You got to be careful about the side effects. But once we get to their 50s and 60s, now physiologically, as a result of atherosclerosis, you know, the blood flow is not going to get there. If they have diabetes, they may have neurological issues, or they may have surgery or radiation. So then that's when one of those medications would be the first line of treatment.
What would you do, I'm sorry, if somebody said, I took Viagra, took Cialis, whatever, at the highest dose and it doesn't work, do you then move on to something else like an injectable?
So you have to make sure.
Because I remember before Viagra, we used Muse, which was the pellet that you put in the urethra. And I used to cringe every time I wrote that prescription.
Well,
so how do you feel about the injectable?
What I would do is, I would say, did you take it empty stomach? A lot of people don't know that if they take Viagra or Levitra with food, which is usually when people are going to have sex, is after dinner.
Because they go out and they have drinks and then they go and have sex.
So if you have fatty food...
It's not me, it's what I hear.
It's true. So if you have alcohol, if you have fatty food, Viagra and Levitra is not going to work. So you want to make sure that at least you have empty stomach. Cialis is a different story because that's a longer acting, 36 hours, you don't have to worry. And most of the time, they say they didn't take it right, etc. If they have given it a try. And also it's important to know that if Viagra doesn't work, Levitra may work, and vice versa.
There is a little variation.
Now, if that doesn't work, going back to your treatment, which is the suppository in the urethra, combination of oral medication with Muse, that would work. The next line of treatment, before we get to the injection, would be vacuum pump. Some people like it, some people don't, but vacuum pump...
It's not really handy if you're on a date to bring a vacuum pump.
It's not very romantic.
I mean, guys don't usually have purses, you know. I bring a backpack, but I don't know.
It's a little bit of mechanical. It's a little bit of mechanical, but sometimes, for example, for patients after surgery...
And it's safe?
It's a penile rehabilitation. It brings the blood flow, it brings oxygen.
I always thought those were like commercials when I see them in the back of a magazine. I'm like, oh, look at this, make your penis bigger.
It does work.
Wow.
So it does work. And also, finally, penile injection is the way to go, but you got to be careful as to how much you give. And finally, the last stage is the penile prosthesis, which is surgery. I like, with what Jill said, one of my favorite one is L-arginine. And there is some good studies about L-arginine as what we call vasodilator, bringing blood flow, which is very similar mechanism as Viagra. So I use that in my practice, and I think pick and choose of what part of her life and her medicine works for us has been a great complementary.
Well, I could talk about erectile dysfunction all day, but we have to take a break. When we come back, our sex show continues with an issue that affects millions of people. What do you do when you have very low or no sex drive? We'll be right back. Welcome back to Dueling Doctors, the show where health experts from the worlds of Western and natural medicine debate the best ways to treat ailments and illnesses that affect us all. Today is our sex show, and we're joined by board-certified urological oncologist and chief of robotic prostate surgery, Dr. David Samadi, and licensed and board-certified acupuncturist and clinical herbalist, Jill Blakeway from the Unova Center. It's time to talk about one of the most common of all sexual issues, low or no sex drive. Libido is described as sexual desire. Low sex drive is a persistent lack of interest in sex that causes you distress. There are a variety of causes ranging from psychological to hormonal to medical issues. Now, you know what it is. Each of our doctors has up to 1 minute to present a treatment plan, and then we'll debate the pros and cons of each. Jill, you went first last time, so we're going to give Dr. Samadi a chance at it. So let's talk about libido.
Well, look, this is something that we deal with all the time. And I think out of all the elements that you talked about, I'm not going to get into the psychological aspect of it, but the hormonal aspect of it is a real deal. And when you talk about sex, you have two people involved. And most men... Usually. and so when men come to my office and they complain about the fact that they are tired, they're fatigued, they don't have the drive anymore, immediately in my mind comes the testosterone factor.
So it's true that men do go through a similar type of menopause that women go through, but it's called male menopause? Or
male menopause is absolutely a reality, or andropause. Now, because it's so gradual, right? And also, they don't feel it as much. Whereas with women, it's very abrupt. So it comes the age, that day they can feel it, hot flashes comes, and women actually feel it. But with men, because every year the level of testosterone starts to go down, it's very gradual.
So when can you anticipate to see the changes in men? About what
I think
decade?
Usually around the age of 50 is when
so about 50 you start to see a decline in testosterone.
Absolutely, and that's when they become couch potatoes, they're tired, they just take the remote, they don't want to do anything, and initiating sex is just terrible. So it affects the partners, the wives, etc. Now, when it comes to women, it's also similar. Hormonal and estrogen level, as it drops down, they would have the same kind of problem. And this is the kind of thing that we deal with. So what I would suggest to men is first check your testosterone level. And that's very important. And testosterone actually goes through what we call a circadian rhythm. High in the morning, low in the afternoon. Always check your testosterone early in the morning.
True.
And repeat it if it's not right. And then you talk to your doctor and find out if it's really low, whether you should get a gel or injection.
So you're talking about hormonal replacement, which comes in either gels that you apply daily.
That's right.
Or injections, which you could do like roughly weekly or every 10 days. And these levels have to be checked.
Important.
To maintain, because you want to maintain a normal testosterone. You don't want super physiological doses. I mean, we're not trying to make
that's true.
Here.
No. Somewhere, a low number would be around 250, and then you would build it up. Mind you, always check your PSA, which is a blood test, before you go on.
So the PSA is the prostate-specific antigen, which is a marker for prostate inflammation and cancer.
Enlargement and cancer before you go on.
Because why? Testosterone?
Testosterone is actually a fuel that can really make it into a wildfire, and you can, even if you were not...
So unopposed testosterone can increase your PSA and...
Chance of prostate cancer.
All right. Dr. Blakeway, how do you feel about low libido?
That is my worry, of course, about hormone replacement.
Having a low libido? Oh, no.
No. My worry about hormone replacement is just that. I think a lot of hormone replacement is not well monitored. I think someone like Dr. Samadi is probably monitoring his patients very well.
And me too.
And you too, my friend. But there is, sometimes it's handed out like candy
doctor
in some
writes
way,
a prescription,
and then doesn't follow up, and we don't know. And it worries me a lot for women, of course, and estrogen. I see more low libido in women than men. Men tend to come into our office with erectile dysfunction, premature ejaculation, that kind of thing. 40 million adult Americans are not having sex at all in couple relationships, which is extraordinary. And a full third of women say they don't enjoy sex or they don't feel like having sex.
Now, could this be in part due to hormones, or it could just be I'm bored with my partner?
And actually, when I see people, I realize there are many layers. There's often a hormonal element. It's often, in my menopausal patients, it's often due to low estrogen or low testosterone.
So what do you recommend for patients that have a hormone issue?
I prescribe herbs, usually, and I like to do it gently. For the people who don't feel like they have much oomph and motivation, people tell me, oh, I'm so tired, I can't have sex. I like royal jelly, which is full of minerals and vitamins,
jelly.
but it has a little bit of testosterone in it, not enough to be alarming, and sometimes it gives people the edge.
Does that come in an edible panty, or is it you take it?
Jelly. It comes in pills or in little kind of honey that you can put in your tea.
Wow.
So no, it's nice.
Royal
so
royal
jelly, and
okay.
it has just a tiny bit of testosterone, and sometimes it's all women need, actually. They don't need a ton. For the people who feel not sexy, just don't feel like they get aroused, that often is related to low estrogen. I like giving people flax seeds and
like
gentle
something
things.
high base in soy.
Something a phytoestrogen of
and
some
actually,
sort.
being a little overweight, fat has more estrogen.
It does.
Than much thinner.
It does. So often my very thin patients actually a little low on estrogen.
A little weight. So definitely
size matters.
So foods that contain more soy.
A little bit of that, I think, is the first line, and then the other people.
The royal jelly, which I'm going out buying right now.
The royal jelly, which is lovely and very good for everyone.
And what about DHEA?
The jury is out for me on DHEA. I think people should be very careful with DHEA. Not everybody has low DHEA. It's another one of those things that should be well monitored, and people can buy it in the health food store, so they feel like it's safe.
Well,
I'm not so sure it is.
People can buy anything nowadays.
I think you should be very, very careful with DHEA. What I like, though, for people is a herb called Chaihu biplurum. A lot of my patients tell me, I'm so stressed, I can't enjoy sex. So they tell me I'm doing my...
levels you out.
Yeah, I'm doing my to-do list in my head while I'm having sex.
A lot of times, not to interrupt you, but a lot of times I think with women, psychology and the psychological factor is a big, whether they're communicating with their partners, whether it's a new relationship, a lot of that, it plays a huge role when it comes to their sex life.
Does.
And because it's so embarrassing, they don't talk about it. So I think just opening up and talking to your partners.
One of the things they can do is the 6-week program in my book, Sex Again, which helps you unravel why you're not having sex. Which
all right, well, we have to take a break. And when we come back, it's time for more sex talk. Up next, treatments for a problem that affects many women and the people who want to love them. Vaginal dryness. We'll be right back. Welcome back to Dueling Doctors. We're talking about everybody's favorite topic, sex. Or to be more precise, lack of sex. Now it's time to talk about an issue that affects many women, vaginal dryness. The walls of the vagina stay lubricated with a thin layer of clear fluid maintained by the hormone estrogen. A decrease in estrogen can cause vaginal dryness, and low levels of estrogen are associated with menopause, breastfeeding, and some medication. Vaginal dryness may cause pain during intercourse and subsequently low sex drive. Now, each of our doctors has up to 1 minute to present a treatment plan. Jill, it's your turn to talk about vaginal dryness.
Well, I see a reasonable amount of vaginal dryness because I look after a lot of women in my practice. Most of it is related to menopause. Occasionally it's related to autoimmune issues, things like that.
Autoimmune meaning Sjogren's syndrome, where they have dry eyes, dry mouth, arthritis.
I see a little bit of that.
It's a syndrome, that's a disease.
All
right, but most of it is hormonal.
Most of it is hormonal. Some of it's related to medications, though. Even some quite simple medications. People who take very high doses of vitamin C, the kind of people who overload on vitamin C for their immune system, they sometimes dry up.
But a common one would be antihistamines as well.
Yes.
Everybody's just reaching for over-the-counter medication, and they don't know why they have a dry vagina.
Every now and again, and every now and again I get someone who's causing it themselves unwittingly, that's using scented tampons or douches or that kind of thing.
If they're using too much scented tampons or using too many douching products, that can always affect
anything that affects your vaginal flora is a bad idea. I'm actually not a fan of any of these scented products.
What about taking baths, perfumed baths?
Same kind of thing. Some people are very sensitive.
So be really judicious about
this.
Just be really careful.
And as a practitioner, I ask those kind of questions when I'm trying to get to the bottom of this. And then I usually tell my patients we need to hydrate from the inside out and the outside in.
Okay, how do you do that?
So from the inside out, obviously make sure you're drinking enough water, essential fatty acids. I prescribe a herbal formula call Liwei D11. It's sold as Romania 6. It's a Chinese herbal formula. I sometimes put a bit of gurgen, which is kudzu, in there because that's been shown in clinical trials to help with vaginal.
And when you said you meant vitamin E as well, or fish oils, would that help?
Yeah, so a good essential fatty acid is a good idea. Then for the outside in, I think a little bit of vitamin E oil is a good place to start. You can sometimes combine that with black cohosh cream or comfrey,
which is very good during symptoms of menopause, especially the hot flashes.
Yes, it's very soothing. And then some kind of sexual lubricant. I always advise one without parabens or glycogen, or things like that. They're easy to come by these days. My patient liked one called Silk, which is made from kudzu fruit vine, but even Astroglide makes a paraben-free
because obviously, if it's pain during intercourse, the female's not going to want to have pain because it's not going to feel good. All right, Dr. Samadi. It's obviously a hormonal issue, is a huge part of vaginal dryness. How do you feel about treatment with estrogen or hormones?
I think you need to know exactly what the underlying disease is. So, as a surgeon, I deal with prostates, but also around the same neighborhood in women, they have the ovaries. So if they have ovaries removed, they would have estrogen problems.
That's like a premature
Exactly right. Or they may have had radiation, and a lot of radiation to the area can cause this kind of scarring or dryness, etc. So you got to be careful about when to give these herbs, or also like estrogen medications, etc. Get to the underlying problem. But certainly, a lot of gynecologists, I know they have good success with giving estrogen supplements. Now, the easiest and the best one is really a flexible ring that they put in vagina. It's a very slow release of estrogen, so it doesn't give you a lot of symptoms from that, and it can stay there for about 3 months, which makes it very easy and can be replaced. If they're not tolerating that, then there's always all the foams and pills, suppositories that can put in vagina that would increase the estrogen. But I think getting to the bottom of this is more important than just treating them right away.
I absolutely agree, and I think with any hormone replacement therapy, you have to talk about risks of cancer and family history with your doctor. Absolutely. We have to go. I wish we didn't, but I want to thank you both for coming here today. We had some great advice from both of you and a lot of information that I hope will help our viewers have tons and tons of great sex tonight and in the weeks to come. We'll be right back. We've covered a lot of sexual topics today. For erectile dysfunction, one quick way to figure out if it's psychological or due to an underlying medical issue is called the stamp test. Take a row of stamps, affix them to your flaccid penis before you go to bed, and if the row breaks off when you wake up, then you know you had a normal erection during the night. I'm Dr. Frank Spinelli. Hope to see you soon on Dueling Doctors for more healthy discussions as you discover your path for your own personal prescriptions. And as always, be sure to talk to your healthcare provider first before making any medical decisions. We'll see you next time.